Hi, welcome to the section of cardiology. This is Dr. Jaitly. In this video vignette, I'll be talking to you about what is a thoracic aortic aneurysm and how serious is it? Well, thoracic aortic aneurysm normally is a dilatation either localized or diffuse throughout the aortic arch, originating from the root of the aorta up to the descending thoracic aorta. So the entire aorta could be involved in small regional areas or diffusely as well. It's the rate of change in the dimension over a period of time serially one follows via imaging techniques that gives an ominous clue that the disease is progressive. Most of the time it is very asymptomatic, and it's only an incidental finding that somebody gets an echo or somebody gets a CT scan or a chest x-ray even, where an aneurysm is detected. Now, once it's detected, automatically it becomes of paramount importance to have it serially evaluated by an imaging technique or a similar technique, which you have been following in the past, with highest accuracy over a period of 3 to 6 monthly intervals. Now, if there's a rate of change of the region where the aneurysm was originally existing, say it was existing here in the arch or here, and that aneurysm now is starting to show further dilatation by 0.5 centimeters or 5 millimeters over a period of 6-month interval, then that is extremely dangerous and significant in a serious matter. And that should be immediately brought to the attention of your surgical team, and the surgical team should immediately evaluate the patient as a whole, and at that point, a surgical intervention may be required. Most of the time, as I said, it's asymptomatic and it's an incidental detection, but there are symptoms that can present with an aneurysm. And when the symptoms start to present, that's a serious emergency also. Chest pain or thoracic pain is a very serious presentation of an aortic aneurysm, because that implies a dissection. Now, notice that I use the word dissection. Dissection implies a tear within the aortic wall. That means now it's tearing inside as a result of aortic dilatation, to the extent that now it is starting to show the endothelial lining being teared within, and sometimes the lumen has a false lumen as the contrast goes in. Say somebody wants to do a CAT scan with the contrast. So you could see a double lumen almost like this, and that is a very significant finding, and that requires the person to be immediately medically stabilized, hospitalized. Emergency surgery is the next step right away. So a chest pain is a very alarming sign in the presence of an aneurysm. Somebody has an aneurysm for several months or years, and sometimes it is stable. Okay, so those ones can be followed for a longer period of time as long as they are stable and not growing in size. But if there is a change in size or a pattern, or there are new aneurysms developing in the rest of the arch or descending thoracic aorta, then obviously that's a significance of worthy seriousness, and therefore should be immediately brought to the surgery team's attention. Syncope or lightheadedness is a very serious sign, and that could be extremely alarming. So those symptoms should immediately warrant an emergency, and patient be hospitalized by calling the ambulance, etc., immediately to the nearest hospital, and notify the physician. The aortic dissection normally, as I said, implies the tearing within the wall. Now, on an echo, the most that you can see is the root of the aorta, and to the extent where the outflow tract is involved. But other than that, you can't really see the rest of the aorta. But this portion of the aorta is also very important, because that gives you an idea as to what's going on with the aortic valves, like I've shown in the right panel. Then it also gives you an idea what's going on with the rest of the myocardium and the pericardium and the left atrium, etc., because those things are also of quite paramount importance. Now, aortic root, obviously, if that is changing over a period of time on an echo, that also implies that there is a significant aneurysm starting to develop, and therefore immediately should be followed by more accurate studies like cardiac MRI or a CTA with contrast. Outcome is really dependent on prompt recognition, as I said, and the treatment be immediately instituted on an emergency basis with using beta blockers and reduction of blood pressure to the level where one tends to minimize any further tear or any further dissection till the patient can be mobilized immediately to the surgery and the surgical team then takes over. Mortality, unfortunately, is still very high, as I said earlier, and so the faster you can recognize, the faster you can assess, and faster you can stabilize the patient and get the patient going to the surgery, the better is the outcome. So unfortunately, it is still high in the best of the best hands and the best of the best centers, but timing is everything, as I said. So I thank you for your attention, and let's talk more later.